Hi, everybody. I want to take a few minutes here to thank everyone for all the hard work. I know nobody signed up to for what we're asking to do. I'm just so proud, impressed by the efforts of everybody at the sites to be where we're at today and where I know we're going to be here over the next couple of months that are going to be the most difficult. And I just want to take the time to tell you a few things. Number one, it's just humbling for me to hear the story after story about what's going on at the sites, and just be completely blown away by how impressive your work has been. And so let's talk a little bit about the virus. I want to make sure everybody's clear about how it transfers from one person to another. It's not airborne. When you open the door to your office and the wind's blowing and there's somebody who's standing there 20 feet away who has the virus, it's not going to hit you. It transfers from one person to another by droplets. So coughing, sneezing, spitting, aspirating, the person who talks and spits at the same time. When that gets on you, that's a problem. And so, I've developed this. Everyone's hearing the term social distancing, physical distancing, whatever you want to say. But that concept of being in a clean bubble. And so CDC says keep the bubble 6 feet. Why not make it 10? Try to make it 10. Now, if you're passing a fellow employee or anyone on the street and you're just kind of moving, 3 feet away, you have to really be inside that bubble for 5 or 10 minutes. And to have those droplets put on you. And so you can maintain that clean bubble. When you're in your office space working, you're good to go. Why are we told to wash hands? Well, if I get up from my desk here and I leave for an hour and somebody comes and sneezes on it and they're infected with the virus, that could be a problem. I put my hands down, it's on my hands. It doesn't go through the skin of my hands in my body. It goes through your eyes, your nose, your mouth, and I think potentially even your ears. That's how you get it. So it's a respiratory disease like all the other coronaviruses. SARS, severe acute respiratory syndrome, MERS, the Middle East respiratory syndrome, and so on and so forth. And so you have your clean bubble. You have a clean work area whether you're in an office or you're working inside a unit. And you're good to go. And so I think the office protocol that we've established going from level 1 to level 4 is good, as long as we follow it. Maintenance, tougher to go into a unit where we don't know if the person's infected or not. But we're down to essential and extreme work orders. Even there, you can be safe. We have the PPE to put on. But the bottom line is, you really don't even need the PPE if you follow the clean bubble. So if a resident's in the unit, tell them to go to another room. You go to the work area, you spray it down, you wipe it down, you do your work, you get out. If it's a faucet, if it's something on a counter, that's where I'm most concerned. You're going into the utility room, you're working on the furnace or something like that. Well, most likely the resident wasn't there. You don't have to worry so much about that. But certainly any hard surfaces, make sure you're cleaning them out. If you want to wear latex gloves when you're going into units, certainly do that too. And then discard them as soon as you're out, and wash your hands to make sure if you did put your hands somewhere, you don't touch your face. By doing that, you can stay safe. Exterior work orders, you're good to go. If you're doing turns, again, you might want to, you might have the property manager leave the turn for 2 days. The virus will last anywhere from minutes in dirt to a couple of days on a hard surface. So if you're going to do a turn, if you want to leave it 2 days, let it clear. If you're worried about that, do that, or go in there and work on something other than a hard surface. You're going to be good to go. So that's the first thing. Understanding the virus. It's not the boogeyman. We want to maintain our distancing, and we want to do that when we leave work too. And so you're going to the grocery store, you're out and about. You want to maintain that distancing. You want to make sure you're not touching surfaces. Maybe even I've seen people with gloves on in grocery stores. The mask really don't matter unless you're affected anyway with the virus. And you want to talk to your family members too, so they're doing the same thing and not bringing the virus back home into your dwelling if they're not doing the same practices. So that's number one, the virus, understanding it. Number two, operating safely, clean bubble concept everywhere. Number three, we're in a tough business here. We didn't sign up for this, but we're kind of quasi healthcare workers. We have a lot of elderly people who we take care of. We have other people with special needs. Our resident now is around way more than what we're typically used to. They're told to stay at home. The schools are out, so the kids are around. And so we're having to figure out how to deal with all these people who are in the buildings way more than what we're typically used to. So that's tough. I think medical breakthroughs are going to be tremendous here, and it'll be rolling forward over the next 30, 60 days. The vaccines, they originally said 12 to 18 months. I think they're going to be ready in the fall. Many companies are working on them. They're already in testing, and so I think that those will be rolled out in the fall. There's therapeutic drugs, 70 that I've heard of. And so companies have taken off-the-shelf drugs that are used for other purposes, like chloroquine, anti-malaria drug, rheumatoid arthritis drug, that are being tested on patients right now. And so I think we'll hear more and more results of these studies, not clinical studies, so to speak, but not anecdotal evidence either. A week ago, there was a report that New York doctors had been using chloroquine along with azithromycin, kind of an anti-inflammation drug, in conjunction with each other on 500 patients in New York who had COVID-19. None were hospitalized. None, of course, were intubated. None died. So that was a tremendous success, as all of them got better. So we'll hear more and more about that as time passes by. The summer coronaviruses the previous coronaviruses don't operate well in the summer, and so that it'll probably tamp down. And during this time period, the therapeutics and then the vaccines will come on, and so when the winter sets on late next fall, I think medically we'll have the solution. So let's make sure we're religious about our protocols in the office, doing maintenance, and then here at corporate. Corporate, probably 25% of our staff are here in the office. We haven't had a case that I know of, and so we've got a clean environment to work at, but a lot of the jobs can easily be done from home, and so that's what's happening, and we're pretty efficient in doing that. And so just make sure the protocols you're following as best you possibly can. Let's remember, Monarch is first and foremost an operating company, and we try to figure out how to operate best and move forward. A month ago, we were moving in one direction, beating everybody. Here, we see the virus comes to the coastal markets, and we're inland. We've got to change the way things are done. And so from the bottom up, from the site level up, from the top down, we've figured out the different ways to operate, keep everybody safe, keep our buildings moving forward. Now, the next challenge is to have rent paid. And I think, through the CARES Act, there's a lot of good things that came of that. The $600 extra per week from the federal government on top of the state level unemployment benefits that our resident is going to be able to enjoy, the two $1,200 payments, the small business loans that will go to small businesses so they can pay their staff that they had to let go. A lot of companies are hiring, so people could take a career change or maybe just a temporary job to get paid, and then many other things that are in the assistance letter that you all worked on and provided to give to our residents. We beat all comers because of our staff. We manage what we own. We don't third-party manage for anybody else. And I think that one of the key elements is that we've got staff, 700 to 800 staff, our owners, of our properties. We've got 1,800 total staff, 800 have ownership interest in our properties. The total's $85 million, and that's apart from myself. And so when you talk about the interests of our investors and the interests of our staff being aligned, that's perfect alignment. Because the better we do better for the investors and for ourselves. Nobody has that kind of program that I know of that's a peer of ours. And so we've got staff and we got owners and we got both. And so the new term they came up with, stoners. Now that's not doing dope and that's not being ahead. That's the staff, ST, and then STOWNERS, stoners. So we've got 800 stoners who have been unbelievable to have as partners for both the investors and the rest of the staff. And I certainly appreciate all the great effort that you're making. And I have to say that during this whole process, as I initially mentioned, I'm just amazed at all the hard work, the dedication, the personal initiative on how to solve problems that's come out of the folks at the site levels, the regionals, the asset manager groups, and so forth. Figure out what we got to do and get it done. It's been amazing to me, and I've been working, from 7 in the morning until 10 at night, but mainly in my cave office, trying to direct traffic and answer questions and talk to staff, talk to our investors, talk to our lenders, figure out ways to do things better. But the bottom line is I'm hating not being on the front line as you guys deal with the issues on the site. And that'll change here in the next couple of weeks as I start to make laps later on in April of sites. But before I do that, I just wanted to take the opportunity to thank everybody for the tremendous and hard work. It's indescribable to me. It's humbling and it's awesome. Thanks again. Carry on. And if you have any questions on any matter, get a hold of me. You can call my cell 303-810-0150. You can text me at that number, and you can also email me nicfpi@aol.com. Thanks everybody, and I really appreciate all the hard work that you're doing.